It's very validating to hear that, because I felt like I had a reason for why I feel so awful when I'm upright and why it's so hard for me to sit up and stand and like participate in life. Okay, so some of you have already put this together based on my last few updates, but we are going to Florida to be treated at a place called Caring Medical that specializes in treating craniocervical instability and cervical instability, and has very good success with often actually putting that instability completely into remission. A quick message before going into this video: just know that this is not affiliated with Caring Medical, this is just my experience. But if any of you guys do decide to see Dr. Hauser, make sure you let them know that Rachel from YouTube sent you their way. So, as many of you guys know, I was diagnosed with craniocervical instability and lower instability a little over 3 years now, and in May of 2019 I had a craniocervical fusion surgery where the bottom of my skull was fused to C2 in my neck. And I know I've shared this many times, but that surgery really didn't bring me the results that I had been hoping for, and it really didn't increase my quality of life. And so over the past couple of years I have tried a few different regenerative medicine doctors where I had received prolotherapy and PRP injections, and PRP stands for platelet-rich plasma, where they take your blood and spin it down, re-inject it in. Anyways, I'm not going to go into detail about that in this video, but basically some of those treatments did help to improve my neck instability symptoms, but not nearly enough to really be acceptable or help me to really get back into like participating in life and feeling well again. So a couple of months ago I became interested in Caring Medical because of one of my friends that went there and had such a miraculous recovery from severe craniocervical instability, and now is running and exercising and going back to school and really being able to start living life again after serious illness. Her story definitely pushed me to look into Caring Medical more, and as I found more and more stories of patients who had been treated there, I felt like there was a difference in the outcomes versus surgery or other regenerative medicine doctors, and it seemed like a lot of their patients who really stuck with the treatments had, I mean, just incredible and miraculous outcomes. And so that's why I decided to look into it further. I did some more research, and when I called the office, the person that answered the phone was extremely knowledgeable about cervical instability and EDS and Lyme disease and POTS, and was asking me about my symptoms and all sorts of things that I just really didn't expect. It was just very different than the other two regenerative medicine clinics that I have received treatments at, where both of those doctors, which I liked and respected and thought, you know, did good work, but both of them said, "You're my first patient with this issue, like I've never seen this before and it's very unusual." And so to have a clinic that completely specializes in your unique issues just was a very comforting thing. That phone conversation led me to send my medical records in, where they reviewed my case to see if they thought that I could be a candidate for treatment there, if they thought that they could help me. So after a couple of days I was contacted and they said, "Your symptoms and your case seems like it might be a good fit for our treatments." And so they scheduled me a call with a nurse. The next week I had a call with one of their nurses, and the call was about 30 minutes long, and they just discussed all my symptoms and medical history. And again, I was very impressed with the nurse's knowledge about these conditions, and they were very attentive to my questions. And after that call, the nurse had Dr. Hauser, who does these injections and treatments, review my case, and in a few more days, they contacted me and let me know that he felt like they could potentially really help me and help with my instability and symptoms, and hopefully the treatments would bring me a much better quality of life. So at that point, I scheduled what they called an evaluation day, and basically it was a series of appointments and testing where they were looking at the level of instability that I still have. I'm about to go into all of the tests that they did, but first I just want to say that something that really impressed me about them is that they actually did all of this testing and were very knowledgeable about all of the conditions that can be related to cervical instability, like intracranial hypertension, POTS, optic nerve swelling, vagus nerve damage, gastroparesis, mast cell reactions, all sorts of things. So I scheduled an appointment for about a month later, which was at the beginning of December. We went to Florida and were able to have all of the testing done and meet with Dr. Hauser. It was quite the experience. So I was nervous going into it that there was the potential that we would spend all this money and come here and they would say, nothing's wrong with you, you're crazy, you're fine, like we can't help you. When you've been dealing with chronic illness for so many years, like a lot of us have been told that in certain instances when we know there's something serious wrong, but a doctor does a certain test and it comes back normal and they say like, there's nothing we can do to help you. And there's really nothing more discouraging than hearing that as a chronically ill patient. So that was a real concern of mine going into it. My husband Jake said, you know, I don't think there's any chance of that happening, but in the back of my mind I was definitely concerned about that happening. So when we got there, they checked me in, and the first thing that they did was a series of ultrasound testing, which is something that they refer to as neck vitals. And they checked the blood flow in and out of my brain in all different positions, laying down, sitting up, flexing my neck. And they put the ultrasound on my temples and eyelids and different places all over my neck. And one of the things that they also looked at with ultrasound is your vagus nerve. And so this is something that was very different, a testing that I had never had done before, but something that I actually had always wondered, like, why don't they just do ultrasound to look at, you know, swelling behind your eyes, or look at the blood flow in different arteries and veins. And so that was something that I was really impressed with just in the beginning, was like the extensiveness of their testing and just how unique it was in comparison to other places that I have been. So in that same room, the tech also tested my eye pressures and heart rate variability, and she actually told me while we were sitting there that my eye pressures were very high and that my heart rate variability was low. Honestly, just with her saying those things, it sparked hope in me that they would potentially be able to help and find things that were wrong that could potentially be fixed. Obviously nobody wants anything to be wrong with them, but when you've been really sick for a long time, getting an answer can be very helpful. So after the initial ultrasound and testing, we had a digital motion x-ray, a DMX, done on my neck, and this was done by their chiropractor, Dr. Brian. I was a little bit nervous about that because moving my neck is hard with my fusion, and my surgeon kind of instilled in me like, don't move your neck ever, which now thinking back I don't think is a good idea. I'll put a little clip in here showing what my actual DMX looks like. It's kind of cool because you can see my hardware in there. My range of motion is definitely limited. For me, the extension tipping back my head was super painful. It almost feels like it like shocks my body when I try to do it. It just makes me like super nauseous, like feel like I'm gonna throw up from pain. So needless to say, that part of the testing was pretty rough, but it's important information for them to look at to see, you know, if and where the instability is happening, and so that they can know how to best address it. Glad to have that over with for now. Initially they were able to show us some of the instability that I had below my fusion, and it was significantly worse when my neck was an extension, which is when I tipped back. And so that kind of made sense because that definitely aggravates my symptoms. And we chatted with the tech and the chiropractor for a while, and I was really just impressed with all the staff that we met. They were all very professional and knowledgeable and just kind. Like, I could tell that they really want to help people to heal and have a better quality of life, and just another reason that I felt good about our decision to come and try this out. After the x-ray, we had a break for a couple of hours before my appointment with Dr. Hauser, and so Jake and I just found him some lunch in a park to rest at while we waited, and we kind of talked about my journey. And it was really emotional because I really wish that I had found this doctor before I had went ahead and gone with the craniocervical fusion, even though I was told I couldn't avoid it. In the back of my head, I really do feel like it might have been possible to avoid that surgery, but I think that the surgery was a part of my journey for a reason. It felt right at the time, so maybe I really did need to have the surgery, and it helped things from getting progressively worse. I don't know. I know I've shared this before, but like, I really wish that I had been given the chance to try regenerative medicine, especially at Caring Medical first before going with surgery. But like I said, it's not something that I like to dwell on because I know that there's still hope for the future, and that's why we're doing this. That's why we're here for the treatment. So after that, we went back to the clinic to have our appointment with Dr. Hauser. Thankfully, I had a place to lay down and wait, and we turned off the lights because I was feeling really rough from all of the travel and from the digital motion x-ray. So there was a nurse that took notes during the appointment with Dr. Hauser, and he reviewed my digital motion x-ray and the ultrasound and neck vitals and all the other testing that they did. Basically, what he showed us is that my brain is almost getting no blood flow when I'm upright. We also took some notes during the appointment, and in his words, he said, "This isn't just a little bit abnormal, it's really, really abnormal." So my jugular vein, when I sit up, is almost completely closed off. I think he said it's supposed to be like 81 something wide, and mine was 4. And he said it was in the top 5% worst of what he had seen in Caring Medical. So as freaky as that was, it was very validating to hear that, because I felt like I had a reason for why I feel so awful when I'm upright, and why it's so hard for me to sit up and stand and like participate in life, because I feel so ill when I do that. And to hear like a solid reason as to why that is was very validating. So as the appointment went on, he explained to us that he believes that the compression of my jugular vein is because of my C3 being rotated. And he also showed on the DMX that I have significant instability below my fusion, and he classified that as severe with, I think, C3 to C5. He also showed us on the DMX that I have some nerves that are being closed off and compressed, and he said that there was a lot of swelling in the joints in my neck. He also shared with us that my eye pressures are high. They're supposed to be about 12, and mine were 25. He saw swelling of the optic nerves on the ultrasound, which to my knowledge is known to be papilledema, which was really interesting because in years past, I was diagnosed with intracranial hypertension 4 years ago. In years past, when I've had testing on my eyes, I did not have papilledema, so I don't know if the testing methods were not as good or if I have developed it. My optic nerves on the ultrasound were very swollen, and the pressures in my eyes were twice of what they are supposed to be. My migraines sometimes get really bad. I get double vision or blurred vision and other like weird visual related symptoms, but on average my average vision is pretty decent, so I think I'm lucky with how high my pressures are. Something else that he mentioned is that my pupils dilate twice as much as they should when they're shined with lights, and he said, so that's why you're probably light sensitive. And I was like, oh my gosh, yes. I thought that was really interesting and helpful that he had a way to show why I'm so light sensitive, and that's something that I still struggle with a lot. Like when we're driving at night, I have to be wearing thick sunglasses, and I'll often wear sunglasses inside, and I always want to be turning out the lights, and when things get really bad I just can't handle anything but like a dark room. That was validating to hear there was a reason why I am so sensitive to lights. Another thing that he mentioned is that my neck curve is off by about 2 inches, and I think there's straightening in my cervical curve and it's too far forward. He wants me to see their chiropractor to help and fix that for about 2 weeks, almost every day before starting with prolotherapy. And he said if we didn't adjust the neck curve, then we wouldn't be putting the neck together in the right place. He said that I'd probably only get about 50% improvement, and roughly in his words, he said 50% isn't enough for me. And just hearing that showed to me like how compassionate he is and how much he really wants to help his patients get as close to 100% as possible. And I know some of you guys might be freaking out by hearing the word chiropractic treatments, because that's kind of like a big no-no in the craniocervical instability and EDS world, but this is a very different and gentle chiropractic approach that doesn't involve manipulations. There's no crazy neck cracks. It's all just little taps done from the front, at least to my knowledge. Just very gentle adjustments that can help with the neck curve. And another thing that I know they're gonna have me do is working with neck weights to restore my neck curve to the right place. So it's not gonna be heavy, big, giant weights. I think it's just light weights that can help you get your neck back into the right position. Honestly, hearing this just made so much sense, and I was thinking like, why is nobody else addressing this? Like the other prolotherapy places I went to did not bring up the neck curve issue. Even other doctors that I've been to that are specialists in craniocervical instability didn't consider correcting the neck curve and that sort of thing. And so I don't know, just all like the idea of getting my neck curve and position to the right place and then starting the prolotherapy treatments to strengthen my ligaments to help keep my neck in the right place just made a lot of sense to me. And of course, this is just me trying my best to recount what I heard from the appointment and the notes that we took, and also the report that they gave us back. So forgive me if I say anything that is not quite correct, but that is the general idea. I feel really good and confident about his approach and methods for treating cervical instability. I think it's very unique from anything else that I have seen or heard of, but it seems like it works in most cases, and so I'm very thankful to have the opportunity to be treated by them. Our first trip will be about 6 weeks long, and I'll start with the chiropractic treatments and neck curve adjustments, and then I'll be doing about 4 prolotherapy or PRP treatment sessions about once a week for the rest of my time here, and then I'll likely take a couple of months off and then come back for about 3 to 4 weeks for the rest of my prolotherapy treatments. Something that Dr. Hauser taught me while I was there is that PRP and stem cell injections are actually a form of prolotherapy, and that was something that I didn't know. I thought that they were all different, but we discussed the possibility of starting with PRP injections with my treatment there because I responded really well to them in the past, but we'll see. I'll just go with whatever they feel is best. I'm just going over the notes that we took during the appointment to see if I missed any other things that he pointed out during our visits. So he checked my gag reflex and said that I had reduced gag reflex, which is a sign of a vagus nerve problem. He also asked for my operative report from my surgery because he wanted to just look into that to have more background knowledge for my case, which I appreciated, and I feel like they're just very thorough in that way. I also asked if he had any other patients that had the same surgery as I've had, and if so, have they had success with them, and he has had a few other patients with my surgery to have treatments below their fusions and has had good success with that. So that was really good to hear because the other doctors I had been to had never seen a fusion like mine, and so just to know that they have experience with my type of case is very comforting. He also shared the DMX, digital motion x-ray, is a lot more sensitive to showing the instability than an upright MRI can be. He checked my fusion to make sure nothing was loose, and that was actually really comforting because I felt like almost kind of abandoned after my surgery, and I wondered if anything was wrong with the fusion, and they weren't really checking up on that. So he said the fusion looks good and nothing is loose, so that was kind of comforting. He said my atlas is about 1.5 to 2 inches too far forward. I have significant instability below my fusion. As the atlas moves forward, that starts to compress the jugular veins, which causes the intracranial hypertension. So it's really interesting to think of the possibility of this cervical instability and forward neck curve causing intracranial hypertension in potentially a lot of cases. I've had 2 stent surgeries for my intracranial hypertension where they put them in my transverse sinus and superior sagittal sinus because I had collapsing of those veins, and so maybe the root cause all along was that the instability in my neck was causing the compression of the veins, and something that could be addressed and fixed. I mean, that's huge. Something also to note is that they did the ultrasound testing when I was, you know, laying down versus sitting up versus moving my neck forward, etc. And all of the testing that I had done on like the veins in my head and brain all were done while laying down. So I think that's it was just so validating to hear, like, that's why your symptoms are so much worse when you're upright. Said the C3 to C4 is severe. Showed the swelling in my joints on the DMX, the nerve compression. He said it was worse on the left side. He also said that when I laid down that my brain would, what he called, flush more and get better blood flow, and so he recommended laying down for 5 to 10 minutes every hour. That might help me to function a little bit more during the day. I already do have to lay down a lot during the day, but it's something that I'm trying to implement so that I can get like better brain flow and function. He kept saying stuff like, you must just feel like your brain isn't working right. He said it was really, really abnormal, not a little bit abnormal. You're in the top 5% of abnormalities at Caring Medical as it relates to arterial flow in your brain. He said that would cause dizziness and insomnia and all these symptoms that I've been having. He even thinks that it's causing my POTS, which to me makes a lot of sense. And that's something that is just honestly overwhelming to think about getting better. Can't remember what it feels like to feel well when I'm upright and standing, but I can imagine it would be amazing. And I will never ever take that for granted again. Okay, so he said you still have high brain pressure, so I still have the intracranial hypertension, which he could tell from the swelling of my optic nerves and my eye pressures, and also the ultrasound testing that he did on the arteries. He shared that my vagus nerve is a lot smaller than what the normal size is. The normal size of the vagus nerve should be 1.8 and mine was 1.1. So we shared with him that I have had PRP injections done by 2 different regenerative medicine doctors, one done in Utah when we lived there, another one done a little over a year ago in North Carolina, and I shared with him how one of them actually helped significantly and the other one didn't, and he said, oh, that's probably because the first doctor probably addressed your ligaments and soft tissue, and the second doctor probably focused on the joint areas, which wouldn't help in your case. And so it's just kind of cool for him to just be able to quickly point out, like, yeah, that's probably why one of them helped and one of them didn't. So that's just an overview of my initial experience with Caring Medical. I think their clinic is appropriately named. They really do seem very caring, and they're a Christian practice. For me as a Christian, that was cool, just going into the office and seeing a prayer box there and hearing Christian music, and it was just like a comfort to me. And overall, extremely impressed, extremely hopeful. I hope that this video kind of explained to you guys why Caring Medical is more expensive than other regenerative medicine clinics because of their comprehensive approach. They actually look at the structural abnormalities and try to see where the issues are coming from, where the instability is, so they can know how to target whatever is going on specifically and help you heal. yes, they may be more expensive than other regenerative medicine clinics, but as someone that has been to other clinics and then come to this one, it was very obvious to me why it may have costed more, because of how much testing they did, how much they invested into my case to really see how they could specifically help me. And to me, it seemed like at the other clinics, they just kind of said, yeah, we'll give you injections, here's your injections, you know, be on your merry way. Like there wasn't really much follow-up care. They weren't, you know, ensuring that I was better and offering different types of solutions and all that sort of thing. So I feel like this clinic really sees people through and really does their absolute best to try to help people to overcome their instability, and that's something that I just think is amazing. So I'm editing this video and I realized that I forgot to share something really special that happened as we were walking out of Caring Medical after a long day of appointments and testing. So we walked out into the lobby and we're just going to talk with the receptionist, and there was another girl standing there, and she looked at me and she said, hey, wait, I follow you on YouTube, you're Rachel. And I said, oh, hi, like, that's awesome. She went on to say that she found my video on cervical instability and said that my videos were really helpful in her journey of being diagnosed and trying to navigate treatments. It was really cool to hear. She had a lot of similarities to my journey. She also has chronic Lyme disease and has done treatments for that, and she decided to come to Caring Medical for treatments with Dr. Hauser for her neck instability, and she shared that her symptoms were around 50% better, and she was in the middle of her treatments at that point. So Ashley, if you're listening to this, I really enjoyed meeting you. It made my day. I was feeling very overwhelmed with everything that had gone on that day, and it really just reminded me that God places us in these situations for a reason. I really believe that our suffering is for a purpose. A couple years ago, I felt really impressed to start sharing my journey with chronic illness. I actually didn't want to. The idea of it scared me. I liked to kind of keep that sort of thing to myself as much as possible, and so the idea of putting it out on the internet was really scary, but I've come to really enjoy it and love it, and I've met so many people that I really wouldn't have otherwise. And it was cool to meet someone in person that said that me sharing had made a difference, and of course that's all God is not about me at all. So I love you guys, you're awesome. I'm really looking forward to sharing my journey at Caring Medical with you, and we'll keep you updated on how things are going. We're very, very hopeful, as I know I've said probably a million times during this video, but it feels right. It feels different this time, and I think that this is going to be something that might change my life. So here we go. My first appointment is tomorrow, and I will take you guys along with me. So be sure to subscribe and follow along, and I'll look forward to seeing you next time. Bye.